Hello, everyone. I am Tarja, the founder and president of Harbor of Life, empowering brain aneurysm survivors in their recovery and healing. Today's podcast is about COVID and the brain, and it's based on questions from brain aneurysm patients. Questions such as, how do we access care, our regular care needs, safely when the hospitals are overflowing with COVID patients? Are we considered high risk for complications of COVID? And what exactly is known about the vaccines and the brain? To help answer some of these questions, our guest today is Dr. Robert Taylor, who specializes in neurointerventional surgery, neurocritical care, and vascular neurology. He's a member of the American Stroke Association, American Academy of Neurology, Neurocritical Care Society, and he's also a senior member of the Society of Neurointerventional Surgery and a founding member of the Society of Vascular and Interventional Neurology. Dr. Taylor has published and given numerous lectures on the latest treatments of ischemic stroke, hemorrhagic stroke, subarachnoid hemorrhage, and neuroendovascular techniques and protocols. We're very lucky to have Dr. Taylor join us, so let's get right to those questions. Dr. Taylor, thank you so much for joining us today and taking time from your busy schedule. We have lots of questions and only about 20 minutes to get through them, so I'm going to dive right into those questions. But before I do, I just gave an introduction about what it is that you do, and it talks about neurointerventional surgery and neurovascular surgery. So perhaps you can just educate us a little bit. What's the difference and what does it mean and how does that work to your day-to-day practice?
Sure. So neuroendovascular surgery or neurointerventional surgery, it has many names. So there could be more than one name for the specialty. It's a minimally invasive way of treating vascular disorders of the brain. So what we do is we do procedures through arteries or veins, mostly arteries, and we go into the artery with catheters and devices and repair things from the inside. So this allows things to be done minimally invasively without cutting or major open surgery. In terms of brain aneurysms, this has made a substantial impact on improving outcomes of brain aneurysm patients. So it's really a growing field. It relies a lot on really interesting new technologies, and it's rapidly changing.
Yeah, and I'm one of those recipients of the gifts of that new field. Obviously, I'm quite proudly wearing some platinum coils inside of my brain, and so far so good after 4 years.
Okay.
So Dr. Taylor, we collected some questions that are very timely right now as we are still battling the COVID. Of course, all of us wish that it would have gone away and or at least gotten out of in control a little bit earlier last year. It doesn't look so. And in fact, if anything, the news are now filled with stories about hospitals filling up and even critical care starting to suffer from that crisis in ways that we didn't anticipate. We've seen news articles, for instance, that perhaps even, I think I saw one article suggesting that perhaps even a person with a brain bleed may not get timely attention and care as a result of it. We've seen articles about oxygen, not having enough oxygen anymore for all patients. So can you tell us a little bit about the reality, especially here in California, and what's happening if you're a brain aneurysm patient, if you get those acute symptoms, what should we do?
So the issue is that we're seeing our highest numbers of COVID patients and COVID patients in ICU or intensive care beds right now, where some hospitals are at 0% capacity.
Yeah.
So these hospitals don't have beds available to admit new ICU patients. So how does this affect somebody who has a ruptured brain aneurysm? Well, it's really a theoretical effect. Now, we're doing everything we can to make beds available for these patients. And I believe currently these patients are being treated. Okay, I don't believe, at least in our area, patients with brain aneurysms are getting a delay in treatment or not getting treatment. This particular kind of patient was probably brought up as an example because a brain aneurysm patient spends a long time in the intensive care unit. They take up intensive care unit bed days for weeks. Now, it's important because these patients can do well. They can spend weeks in the ICU and actually have excellent recovery. So I believe, there's an example brought up about possibly brain aneurysm patients not getting the attention they need. This was really theoretical. This was a theoretical example, I think, mainly used simply because brain aneurysm patients, you spent a lot of time in the ICU.
Yeah. Now, we also need immediate care when it's an acute issue, such as a rupture. So I know that there's some anxiety also in the part of some of the patients as it relates to just even going into a medical building or a hospital. How safe is it to enter? So I don't have COVID today, but what if I come to see you in your practice and somehow I get COVID because I'm in a situation where there are other patients who might be carrying it?
Right. So the issue is that patients who may have mild COVID or mild symptoms are not coming to the emergency room. They're asked not to come, to not infect more people potentially. Now, how does this affect somebody with a brain aneurysm, for example? Well, the issue is that people are afraid and are not coming to the emergency room as quickly as they used to, I believe. Right. And so what I think the trend we're seeing is really that patients are staying home maybe for a few days longer, and they're coming in worse condition with a brain aneurysm bleed. I think that's the trend we're seeing right now with the COVID crisis. There was one recent study showing that patients with aneurysm ruptures in 2019 during the COVID epidemic came into the hospital 2 days later than they did the year prior before COVID. So this was a direct comparison. And I think this is the reality. I do believe that this is probably what most people are saying. Now, I think if anybody has a sudden severe headache, they just need to come to the ER. That would be the recommendation.
Yeah.
No reason to stay home for a few extra days. A sudden severe headache is not what you experience with COVID. It's right. What you may experience with an aneurysm, and that's an emergency.
Yeah, absolutely. And I know that headache quite well. And I also understand that sometimes every second and every mile can be a part of your brain. So don't wait, is what you're saying. Go and get that medical help.
Yeah, I mean, what can happen, somebody stays home and then the aneurysm re-ruptures 2 days later, and then they're in worse condition. And that's what we don't want to happen.
Absolutely. What about for just regular care and checkups? Many of us need to have our yearly checkups, for instance. Are you suggesting to kind of hold off of those right now in the middle of the worst crisis? Any advice on that regular care cycle?
I think that many routine checks are getting rescheduled and not happening. If there's a need, a symptom or something, what's happening is some providers are doing telemedicine consultations, so on video, that can be done. In my office, for example, what we do is we stagger patients. So there's really just one patient or one family in the office at a time.
Okay, that's very good. Thank you for that information. I'm going to cheat sheet. I have a little cheat sheet over here because we did get enough questions. I want to make sure that I get to all of those. So I'm going to switch gears a little bit and go more from that, how do we get to care, to talking about the COVID and its effect on the brain. Like everything else about COVID, we hear about COVID and the brain quite a bit, and we've heard different kinds of reports, including some that suggest that COVID can have either a direct or indirect effect on the brain or neurological issues, at least following a COVID infection. Is there anything that you feel we really truly know about this for sure, or is this still a growing body of knowledge for across the board?
Well, it's a growing body of knowledge. We're learning things mainly by case reports and small case series. So what this means is we know COVID can affect the brain, but probably it affects the brain significantly in a minority of patients.
Okay.
So most people have COVID, and just like people can have asymptomatic COVID, they don't have any respiratory symptoms either. They're not going to have any neurological symptoms either. So, but we do know, and we're just learning what these effects are really.
Mm-hmm. So there is this very important question that keeps coming up a lot, and especially as we think about sort of the next steps leading also into how we get prioritized as the vaccine comes aboard. Before we talk about the vaccine, I want to ask this question very specifically. Are brain aneurysm patients considered high risk in relation to COVID? And I'm not totally even sure we totally understand what is meant by high risk, but everybody talks about high risk patients with existing medical conditions. So is ours an existing medical that is considered high risk in relation to COVID?
I think if somebody has had a brain aneurysm and it's been properly treated, then they're really not at much risk of it affecting them during COVID. Now, any patient who's had a prior stroke and neurological symptoms after their stroke, with any infection or any bodily stress, these symptoms can recur. So you could feel like you have the stroke symptoms you had in the past, again, with the infection. It doesn't necessarily mean you're having a new stroke, but that definitely can happen. And so patients who've had prior neurological injuries may suffer potentially a harder time with a COVID infection, mainly because they have prior injuries and that are being affected by it.
Okay. And I have to ask a very basic question because you used the word stroke and I used the word brain aneurysm rupture. What is the difference between brain aneurysm rupture and stroke? Are they one and the same? Or are they different?
So, it is a brain aneurysm ruptured is considered a subtype of a stroke. It's in a category of what's called a hemorrhagic stroke. So that's how you can use that term sometimes globally. But aneurysm rupture is very much more specific, and it's much more clear what we're talking about. But brain aneurysm, patients who've had ruptured brain aneurysms can also suffer strokes through their course. So that's what can happen. So through the hospital stay, patients can have injury from the aneurysm rupture, but they can also have had some amount of stroke that came along with it. So they do go hand in hand. That's
helpful. And of course, these terms matter because oftentimes the only word that we hear is stroke. When we look at the public information. So that's very helpful. So I'm going to talk a little bit more about the vaccines, and that's the talk of the town, of course. We have 2 vaccines approved right now here in the United States, one by Pfizer and the other one by Moderna. Both of those vaccines are using a relatively novel technology, this RNA technology, which has great promise, but it also is a little bit less proven than our traditional ways of doing vaccines. I anticipate that the third vaccine that we will soon have is perhaps AstraZeneca, that's using more traditional um, uh, technology and platform. So the question that is coming up quite a bit is adverse effects from vaccines, in just for anyone, but certainly as it relates to someone who may have issues already that have to do with the brain. What do we know, and what do we have to learn the hard way?
Well, anybody who's had a prior adverse reaction to vaccine is really the person who needs to take caution with getting another vaccine. So that's really the category. Other than that, it's going to be recommended that when the vaccine is available to get vaccinated. Somebody who has had a brain aneurysm rupture is not at any more increased risk of having an adverse reaction. And in addition, somebody who's had a prior brain aneurysm rupture may have a harder time with the COVID infection. So in general, I think the vaccine is currently these two vaccines available. They're 90% effective. There can be some adverse reactions. They may be unpredictable, but for the most part, people are tolerating the vaccine, and it will be recommended for people to get the vaccine.
And so following up on that note, of course, I had to go to the CDC guidelines on their website and take a look at the suggested priority order. And once again, I think not using the term brain aneurysm patient in there, I did find that there's a phase 1C priority that should be given for people with underlying medical conditions that increase the risk of serious life-threatening complications of COVID. Does that qualify us to be in a 1C priority group? And I know that some, the local determinations of that are perhaps different, but what would you say?
Well, that is that's a difficult assessment. There's so many specific diseases to go through here, to put under this kind of category. Now, it would be very hard to lump aneurysm survivors into this category. And the reason really is that there's such a wide range of outcomes, how people do. Some people are completely normal and really don't belong in this category. The aneurysm is treated, they're well and healthy, and they're not, they're going to do well. So it doesn't really make sense to lump everybody. Now, there could be other people who've had a harder course, they've been through rehab longer, they have residual deficits, and somebody like that, it makes more sense to be a higher priority. But I would be surprised to see that the CDC creates aneurysm survivor into this category, just because it's too variable.
Yeah. So for that individual person who is anxious to wants to have that vaccine, do they call their neurologist? Do they call their general practitioner? What do they do if they want to find out?
The vaccine is becoming available at certain sites.
Yeah.
At least at the moment, it's just becoming available for people over 65. So that's the next category. It's been upfront healthcare workers, for example, people working in the emergency room. Then it's been other healthcare providers, doctors and clinics and their staff have been in the next tier. The third tier is going to be people over 65. And it's a good question. How do you put in aneurysm survivors here? It's a really good question. I don't have the answer.
Yeah.
I don't think the CDC has the answer.
And I think that's not the only answer around the vaccine distribution that we're still looking to resolve nationwide. But this is a great conversation. Those were the most critical questions that came directly from sort of what we called the immediate news-driven questions in the minds of brain aneurysm patients. But just sort of on a larger scale, this is a time of great anxiety. It's a time when brain aneurysm patients who often, for various reasons, already feel isolated and are struggling with varying levels of medical issues and sometimes emotional issues. It's a tough time on top of all of that to be confronted with a crisis that's making us even more isolated, perhaps. And it's also a scary time. So, just curious from your perspective, you see patients every day.
Mhm.
Um, what would you like to say to brain aneurysm patients who are out there listening to this podcast today?
Well, I mean, I believe that a brain aneurysm patient who's had their aneurysm properly treated and secured, I would offer reassurance to that patient. I do not believe there's a likelihood that this is going to cause their aneurysm to rupture again, or a new aneurysm to suddenly form necessarily. We have not recognized this as something that's happening, and we don't suspect it. Now, it's possible somebody has a brain aneurysm that's untreated. So this particular, and we follow lots of brain aneurysms. Not every aneurysm does need to be treated. Now, what if this patient gets a COVID infection? What is the risk to that patient? This is really an unknown. Now, sometimes we think that the systemic inflammation of the infection can have some effect on blood flow and aneurysms, and that there's maybe a possibility the aneurysm has a higher risk of rupture. We do know that some COVID patients are having ischemic strokes. What's happening is the blood is clotting and having ischemic strokes. So this can happen. Exactly what the risk is, we don't know, but we are seeing it occasionally in some people.
And are there things we can do to take more control of our lives in the meanwhile?
Well, I think wear a mask, take precautions not to get COVID, get the vaccine when it's available. And if anybody who has stroke-like symptoms, a sudden severe headache, weakness on one side, just go to the emergency room right away, call 911.
That's very, very good advice. Thank you so much for joining us today, Dr. Taylor.
Okay.
And let's make this year count, and let's hope that we can get COVID under control.
All right. Thank you very much.
Thank you. Thank you for listening. I hope you found this conversation helpful and will also share it with others. Please reach out to us on Facebook, LinkedIn, or Twitter if you have any questions or would like to further the conversation. This podcast was brought to you by Harbor of Life, building local connections for brain aneurysm survivors. If you want to learn more about our not-for-profit organization, you can go to theharboroflife.org.